Welcome friends to this section on IoT applications. In this section, we are going to have different sessions on use cases of IoT in different industries like healthcare, connected cars, IoT in retail, smart homes, IoT in agriculture, and so on. In this session, we are going to look at what do we mean by connected healthcare. When we are speaking of connected healthcare, I will be talking on the challenges and thus the opportunities in healthcare. I'll be talking on biosensors. What do we mean by biosensors? And ultimately, what is connected healthcare and what is the role of biosensors in connected healthcare? To begin with, let us try to understand how traditional healthcare works. As a patient, you may feel sick, you may not feel alright, you see some symptoms. You go to the doctor. The doctor gives you some medicine. You take that medicine. Sometimes you feel okay, sometimes you don't. So you go back to the doctor. The doctor asks you to do some test. You go to the laboratory, you get the test done. The doctor gives you medication. Sometimes it works, sometimes it doesn't work. Then you're recommended to go to a specialist. The specialist puts you on an extended dose of medicines. You keep traveling to the specialist. You keep spending money. You keep going to the pharmacy. And then you may get well, or you may end up with a chronic disease. This is how traditional healthcare works. In the traditional healthcare, the doctor plays a very important role in the entire system. Let us see some of the challenges that the healthcare industry faces. There is a rise in the aging population across the world, and more so in some specific countries like Japan. Aging population needs medical care, they need medicines, they need treatment, and as such, they are a burden on the healthcare system. And the aged people not only need care and medicine, but they also want respectful living. They want to remain independent. So it is also a psychological requirement that the elderly people expect. Again, it creates a need from the society. Another challenge in the healthcare industry is the shortage of the primary care and the secondary care workforce. So whether it is the doctors or the nurses, there is a mismatch between resources available to deliver care and the demand for that care. In recent times, it has been observed there are patterns of diseases that were not known before, or different patterns of diseases coming up, as a result of which there is a need for new medicines, new care, new treatment mechanisms, and so on. Most of the specialists and the good hospitals are concentrated in the urban regions, making it difficult to deliver care and treatment to the rural parts of countries. This problem is grave in developing economies like India. And as patients and people are getting more and more access to internet, they are finding out a lot about their diseases online. And when they visit the doctors, they are very demanding in terms of the care that they expect and the best practices of medicine that they expect from the doctors and the hospital. This brings us to the opportunities that are available in the healthcare industry. The challenges create opportunities. In the world today, there are close to 1.5 billion people who are suffering from chronic diseases. By chronic diseases, we mean diseases that are progressive, that increase over a period of time, and that need medication in higher doses over a period of time. Some of the chronic diseases are diabetes, blood pressure, diseases related to the heart and the cholesterol levels, and so on. We also have a lot of aged people around the world, as a result of which there is a tremendous demand for healthcare services. It has been found out that almost 75% of healthcare spending is spent on chronic disease management, that is, diseases that are progressive in nature. Additionally, because of the mismatch between the need for care and the resources available to provide the care, there is a grave shortage of hospitals, of nurses, of doctors, of pharmacies, and so on. As a result of which, there is a massive growth market for new systems which improve productivity, which cut cost, and which support the shift of healthcare from the hospital to the home. I repeat, which support the shift of healthcare from the hospital to the home. This last statement is the essence of the impact of IoT in the healthcare industry, or what we generally term as a connected healthcare mechanism. Before we move to the concept of connected healthcare, let us try to understand what we mean by biosensors and smart biosensors. To begin with, let's look at what do we mean by a biosensor. By definition, biosensor is an analytical device used for the detection of an analyte. It combines a biological component with a physiochemical detector. Let me explain the definition with an example. We must have seen many people, the elderly people of our house, pricking their fingers, taking a drop of blood, putting it on a strip, inserting that strip in a machine, and measuring the sugar level. The most common device is known as AccuCheck by Roche. Now this is a biosensor. It uses a biological component, that is blood, on a physiochemical detector, that is an enzyme known as glucose oxidase, for the detection of an analyte, that is the detection of glucose. Thus works the biosensor. The AccuCheck device is just a biosensor. It is not a smart biosensor. When would it become a smart biosensor? Or when are biosensors defined as smart biosensors? Smart biosensors can self-calibrate. They can adjust the deviation in sensor output. They know when the calibration is required. Smart biosensors can communicate. They capture the data, and that data is transmitted to the cloud for storage and analysis. Smart biosensors can do some amount of computation, maybe some basic measurements or even advanced measurements right on the device. Smart biosensors can do multiple sensing. They can measure multiple parameters at the same time. These are some of the characteristics of smart biosensors. There are different types of smart biosensors. Intrusive elements, intrusive variables, consumer products, and smart medical equipment. By intrusive elements, we mean those biosensors that are implanted into the body and communicate to the cloud over some wireless systems. We have implanted pacemakers, or we have stents that act as biosensors. We have intrusive variables like smart glucose meter, which are external devices that clinch to the body, have injected into the body and measure some parameters of the body and send them to the cloud. We have consumer products like fit bands, wristbands, smartwatches that measure parameters of your body through external means. And then this data is communicated over the cloud. We also have smart medical equipment. The traditional equipment made smarter with the ability to collect data and send it to the cloud for further analysis. Our ECG systems, X-ray machines all fall under this category. Let me show you an example of a smart biosensor. This is a smart glucose meter. It has 4 components. There is an insulin pump. Insulin pump stores insulin. There is an insulin delivery cannula. This cannula is used to inject insulin into the body of the patient. There is a glucose sensor, which is again injected into the body. In real time, it measures the glucose readings of the body. And you have the wireless transmitter to the insulin pump. The glucose reading is transmitted to the pump and to the cloud. So if you have to arrange these 4 components of the smart glucose meter in sequence, it would be C, D, A and B. That is, the glucose sensor would first sense the reading from the blood. Using the transmitter, the reading is transmitted to the cloud and to the insulin pump. The insulin pump does the analytics, decides how much of insulin needs to be injected into the body. And finally, the insulin will be injected into the body through the cannula. This is how the smart glucose meter works. Here is another version of the most widely used smart glucose meter in the world. The advantages of using a smart glucose meter or a smart biosensor is we get real-time monitoring of the sugar levels. We can know of emergencies in real time, and sometimes that can be really life-saving. Before a patient collapses because of very high or very low sugar levels, we will be able to monitor and take care of such emergencies. We have access to patients' health data because the readings are transmitted to the cloud, and we can have an historical analysis on the patient's body and on the patient's sugar levels. Analytics can really help us proactively change medication if it's really required. Again, a graphical way of showing the importance of smart biosensors. In the first case, you can see that there are instances where the sugar levels have gone beyond the threshold, but the readings that we take are within the threshold. So we may think that my sugar levels or glucose levels are fine. Whereas when you use a smart biosensor, you're monitoring it in real time. You will know when exactly your sugar levels are going beyond the threshold. Thus, the real-time monitoring helps take care of emergency situations with smart biosensors. That brings us to the concept of connected healthcare. What do we mean by connected healthcare? What are the fundamental principles behind connected healthcare? As such, there are 4 fundamental principles in the operation of connected healthcare. 1. It has to lead to an improved access to care because of faster response times. 2. It has to increase the quality of care because of analytics and the data that has been collected of the patient over the years. 3. It has to improve the scope of care. Each patient is going to be treated differently and the medication has to be personalized. And 4. It has to result in a reduced cost of care. That is, healthcare should become affordable. These are the 4 principles which guide the system of connected healthcare. In short, It is the right care for the right person at the right time with the right cost. Let us look at a video that shows us the significance and the importance of connected healthcare and the results that connected healthcare bring to our lives.
Do you think an orchid will ever be able to tell its story? Do you think a flower will one day tell us where it was grown, how it was treated, or how it got here? Do you think it's possible to teach traffic to speak? Do you think a car can call an ambulance faster than a phone? Do you think it's possible for devices to automatically deliver important, often life-saving data to those in charge? Can you imagine an ambulance that gathers critical information before arriving at the hospital? And that a patient could be examined before he even enters the emergency room, saving precious time for the patient and his family. None of this is science fiction. It's all part of a concept that our team has been working on for several years, the Internet of Things.
You saw in the video that when a person meets with an accident, he's taken to the hospital. There are about 15 to 20 minutes that are spent between the accident and the patient brought to the hospital. How the connected healthcare system works. The ambulance has fetched real-time data from his personal gear, the smartwatch, and so on. This data is sent to the cloud. The doctors have fetched the recent data as well as the historical data of the patient from the cloud. They have analyzed it, and even before the patient enters the hospital, the doctors are ready with the kind of treatment that needs to be delivered. Those 15 to 20 minutes are really life-saving. This is what we mean by a connected healthcare system. What happens here is that biosensors are collecting data of the patient. The data gets collected every day, every moment of our life. This data is then sent to the cloud through some mechanism, through some communication module. The data on the cloud is continuously analyzed. The patient is continuously analyzed by the doctor through this analytics system. The doctors are monitoring the insights from the analytics. If they think that the medical situation has changed, they may recommend a change in medication. Thus, this change in medication is proactive and not because the patient has come to the doctor. The doctor by himself thinks that the patient needs to be treated differently. The medication is sent to the patient over the mobile device or is directly ordered on behalf of the patient and is delivered to the patient. Thus, in this overall scenario of connected healthcare, the patient is treated proactively ahead of his or her visit to the hospital. This is the essence of connected healthcare. So what has connected healthcare achieved? It has given us a concept which we know as remote patient monitoring or RPM. What is RPM? RPM uses sensing technology and telecommunication methods to deliver monitored data and insights to clinical professionals like doctors from remote locations or wherever the patient is based. This is what we started our understanding of connected healthcare. In short, it is taking the hospital to the home of the patient. The patient is treated not when he is brought to the hospital, but where he is at that particular instance of time. What this does is the doctors don't have to wait for patients to fall seriously ill. They can be treated at the slightest symptom of change in medical conditions. This also means that the number of beds in the hospital will not be occupied by patients who fall ill because they have not been treated when it was required. Hospital beds can be given to the right patients, and the number of patients treated in the hospitals will eventually be good for the entire society. Thus, RPM is a concept that can really help in sorting out the challenges of the healthcare industry. There are certain benefits that are achieved through connected healthcare. The important benefits are: we get reduced hospitalization because patients are treated when there is a slight change of medical conditions and not when they are really fatal. We get improved medical outcomes because there is use of analytics and patients are treated when they just need the treatment. There is improved access to care because every patient is treated differently. Even if two patients have the same symptoms, the treatment will vary because the analytics will differ. Over a period of time, technology will ensure that connected healthcare is affordable and convenient. Eventually, connected healthcare makes efficient use of resources. The entire healthcare industry, including the hospitals, doctors, nurses, pharmacies, all of them will be used efficiently to ensure the overall health of the economy is fine. Let us watch a video that concludes our discussion on connected healthcare.
Let me tell you about my medical practice. I can consult with patients wherever they are, and that ultimately saves lives, time, and money. I can ask them about their symptoms and consult with them remotely. I can even monitor their vital signs, like their heart rate or blood pressure, and receive alerts when something requires my attention. Then, depending on the situation, I can share that information with a whole network of healthcare colleagues and reference the latest academic papers, pharmaceutical data, and drug databases online to deliver the best of care and analysis, while all the time having access from anywhere to my patients' records, which are stored safely and securely in the cloud. In fact, just today, I had a video consult with a patient who was not well enough to come in to see me. I quickly assessed the patient's needs and authorized a referral to the nearest hospital for further testing. The best part of being able to update patient records from anywhere is that they are automatically updated everywhere, which keeps everyone involved up to date and well informed. I can now help more patients in one day than I ever could before, and that saves me time and the healthcare system money, without sacrificing the quality of patient care that I've always delivered. In fact, now with even more information and the ability to collaborate with fellow doctors all just clicks away, I have better patient-doctor relationships than ever before. In this new connected healthcare network, I can provide care for my patients, whether they're in my office or halfway around the world. But it doesn't stop there. Being able to consult my network of colleagues helps accelerate medical breakthroughs. Now, if we could only connect to find a cure for the common cold.